Troubling news for those who booked an appointment to receive an AstraZeneca shot. Pharmacies are low on supply. The Ontario Pharmacists Association predicts doses can run out in just days.
We are expecting most stores to be out of the AstraZeneca vaccine by mid to late this week, potentially rolling into a bit of the weekend. So it is challenging because demand continues to outpace supply.
Chief Executive Officer of the OPA, Justin Bates, says over 1,400 pharmacies across Ontario are dealing with a lot of uncertainty right now. The association is trying to come up with a plan B.
We're working with the government right now to launch a limited launch of the Pfizer vaccine into pharmacies, focused on hotspot regions so that we have continuity when it comes to supply.
We reached out to the province for a comment, and they said in part, with approximately 245,000 doses remaining and future shipments not expected until May, we will continue to administer AstraZeneca to individuals 40 and over in pharmacies and primary care settings until we receive additional supply. They also say it's up to each pharmacy as to how many doses they are able to administer, which will depend on their individual inventory. Pharmacies are expected to contact patients if there's a need to reschedule an appointment, which some have already been doing. But people are upset. Twitter user Natalie Day tweets, "I had an appointment for AstraZeneca tomorrow and it was canceled due to a lack of supply. The province is a joke." Bates has his eye on the south of the border for a solution.
We are cautiously optimistic that the federal government continues to engage in negotiations with President Biden and getting the U.S. supply up here, because it's sitting in a warehouse and it's likely they won't use it and it will be expiring soon.
Earlier today, White House Press Secretary Jen Psaki said there are approximately 10 million doses that could be released if and when the FDA allows it, which could happen in the coming weeks. There are also 50 million doses that are in various stages of production, which could be completed from May to June. Psaki would not say whether Canada would be getting any of those doses.
Our team, our national security team, our COVID team, working with the State Department and others, we're going to assess a range of requests, a range of needs around the world. But that's the timeline, just to give you a sense.
Is there a concern that people won't be getting their second dose on time?
Well, we are hopeful that the U.S. batch will have enough doses that will manage the second dose so that everybody goes within that up to 16-week time period. Right now, we started this program in mid-March, so there is time.
The Chief Executive Officer of the OPA says that right now there is research being done on mixing doses, which will be published in 30 to 90 days. But right now, they are sticking to the regimen of administering the same vaccine for the first and second dose. For City News, I'm Maleeha Sheikh.